Thank you again, everyone, and welcome to our first community advisory meeting. My name is Nina Levine. I'm the STEP Learning Collaborative Director of Community Engagement and Partnerships and the Program Coordinator for the STEP program. So we're very happy you all could join us. One of the most important parts of the Learning Collaborative is hearing from stakeholders like yourselves across the entire state. And we're excited to integrate your voices into our work. We're going to hold questions, reflections, and introductions of yourself until the end, but please feel free to drop any thoughts in the chat, write them down as we go. And I'm going to go through some quick slides that will give a snapshot of what we've done so far, and also how we use data to help shape where we are going to go next. We're also going to talk about some ways that you all can help to get involved in this work moving forward. It's a quick outline of what we'll be covering. And I am going to see if I can play this quick video that to kind of orient folks to what what the STEP Learning Collaborative is. So I'm actually going to stop sharing my screen because I think the sound might work better if I just do it right from YouTube. So hold on one second. Can everyone see my screen okay?
Yeah, I can see it.
Can you hear the sound?
Not yet. No sound.
Okay, hold on one second. Gonna see how I can share the sound here. Sorry, one moment. To enable the sound sharing on this.
Unfortunately, many people face delays in getting the help they need, which leads to poorer outcomes. Disorganized systems often send these individuals down a pathway that delays immediate treatment, prolonging the duration of untreated psychosis. There are many key players that can unintentionally misdirect someone in crisis toward jail or a distressing and unnecessary ER visit before finally, potentially, getting help. Key players are all around us in our community. However, a shift in perspective can empower these players to actively become part of the solution instead. That's where the STEP Learning Collaborative comes in. STEP Learning Collaborative is a network of experts, clinics, and community members working together to reduce the time it takes for individuals to receive psychosis treatment. It all starts with a single call. Anyone can call. A patient, family member, clinician, coach, anyone can reach out to the STEP Learning Collaborative referral line. They'll speak with an early detection and assessment coordinator who's especially trained to help. The coordinator connects the patient to the right clinic within one of 5 regions in Connecticut. From there, the coordinator addresses individual barriers that a patient might experience. This might include any issues a patient has with making it into their initial appointment with the clinic. The coordinator then monitors their progress via survey. But that's not all. The learning piece comes into play because STEP Learning Collaborative is designed to be a learning health system. That means it's not just about providing care, it's about learning from every patient experience to continually refine and strengthen the system over time. We use detailed assessments of patient outcomes across the network to determine what's working and what's not, to guide continuous improvement. And here's what makes it even more powerful. Multiple work streams are running in parallel, all working towards the shared goal of improving the system and ensuring everyone is learning how to improve the patient journey together. These work streams include educating community members, clinics, and family members to help with early detection, research to develop new treatments, assessment to continuously improve access and quality of care, and building sustainable and cost-effective models of care. At the heart of it all is the patient. Every learning activity is grounded in the patient's experience with the goal of delivering more effective, compassionate care. The patient is not just the beneficiary, but the source of the insights that drive continuous improvement. The goal? To enhance access and quality of care by organizing a network of stakeholders into a coordinated system where everyone, from doctors to families to community members, work together to guide people towards the care they need faster and continuously collaborate to improve the quality of care. The result? A more responsive, coordinated system where people facing psychosis get the care they need faster, improving the outcomes for schizophrenia.
Just gonna go back to my slides. So I'll go into like a little bit more detail with what was described in the videos. And we're happy to share that with folks at the end too. Okay. So just wanted to share a quick look at the STEP Hub team. That's the folks located in New Haven. And as you can see, we bring together a multidisciplinary group with diverse experience. So we have social workers, psychiatrists, psychologists. We have an undergrad student helping us. So lots of different expertise coming to the table here at the STEP Hub. So based on population estimates, Connecticut expects approximately 500 new cases of schizophrenia each year. Many of these individuals eventually will interact with local mental health services, but not all are being identified or connected early, which is why a coordinated statewide approach that we described in the video is necessary. So how are we addressing this in Connecticut? I'm just going to situate the work. I won't go through all of the details on this slide, but as Dr. Shahari mentioned, the STEP program began in 2006, the STEP Clinic, and was a Department of Mental Health and Addiction Services and Yale partnership. And that early collaboration really laid the groundwork for testing whether coordinated early psychosis care could actually improve outcomes in the public sector. We did a trial, a randomized control trial from 2007 to 2013, and that ultimately contributed to what became the national model for coordinated specialty care in the United States. Folks might remember our Mind Map campaign that ran from 2014 to 2019. That really showed that community-based outreach could meaningfully reduce the duration of untreated psychosis. And it also reinforced that access and not just clinical level care mattered. So jumping a little bit ahead to 2021, we formed the statewide first episode psychosis planning committee that aligned DMIS, Department of Mental Health and Addiction Services, the Department of Children and Families, Young Adult Services, and STEP around a shared early psychosis goal and a population health strategy for the state. In 2023 and 2024, we engaged the local mental health authorities. And then In 2025, annual legislative reporting on the STEP Learning Collaborative's progress and outcomes became a required element of our work. We're happy to share our second annual report, which is available on our website. So we share this timeline to underscore that the STEP Learning Collaborative is built on evidence, partnership, and careful implementation. So the mission of the STEP Learning Collaborative is what guides our work, and that is for all persons experiencing schizophrenia to live fulfilling lives. So in terms of, these are some of our goals that we are working towards in the STEP Learning Collaborative. So improving access by striving to shorten the duration of untreated psychosis and deliver safe, timely, and effective pathways to and through care for every young person experiencing first episode psychosis. And we also include workforce development, stakeholder outreach, informatics, care model refinement, and sustainable care models as part of our goals. Okay, so here is a map of the state, and all of these dots represent the agencies, the local mental health authorities that are part of the STEP Learning Collaborative Referral Network, and they're also listed on the right. We have a central referral number for the entire state that anyone can call, which is 203-200-0140, but we also have an online referral form that anyone can use to make a referral. I will mention that the STEP Hub provides coordinated specialty care, and the other sites provide a variety of other models. A key element of what we do is we also check in with people every 3 months, individuals who have agreed to be a part of the Learning Collaborative. And we check in on a variety of outcomes that I have listed later and we can go through. So really the heart of a lot of what we do are the early detection and assessment coordinators that staff our referral line. We like to call them EDACs because we love a good acronym. So they're the point of contact for the local mental health authorities and also any referrals that come through. So our EDACs provide screening and rapid eligibility assessments along with support for referrals that do not meet eligibility criteria. They facilitate quick referral and engagement into outpatient care, regardless of insurance status, with a goal of connecting individuals within 7 days to their care. We also conduct ongoing evaluations, like I mentioned, offer continued engagement support, and assist receiving agencies, the LMHAs right now, to ensure smooth transitions and continuity of care. Here's a quick look at our referral data that we're tracking, specifically focusing on who is making the referral calls or online inquiries. We categorize callers into 2 groups. We have clinical nodes, which I don't know if the writing is too small on the screen, but those are referrers that are coming from, for example, psychiatric inpatient units or outpatient mental health care. And then our other group is community nodes that those include people like family members, the individual themselves who might be experiencing symptoms. While the results aren't surprising to us, they highlight an important opportunity. Like I mentioned, we're trying to bring vast array of stakeholders together and also working on activating additional referral sources. So we know that these are professional outreach and detailing. We call it POD. We have strategic plans to target each of these important groups across the state, which is also why we've brought people together here today from a variety of stakeholder groups. And we also understand that individuals may not exist in just one stakeholder group, and they may be a part of several. So we wanted to bring people together to hear from folks across the state and across varying stakeholder groups about how we can move this work forward, continue to move it forward. So our statewide early detection campaign uses a three-pronged approach. So first, mass media. So folks might hopefully have seen some of our billboards, bus ads, and news spots that we had. Those were since the inception of the STEP Learning Collaborative, so back from 2024 to early 2025. And this, the early detection campaign really sets a clear call to action, which is to call our referral number. The second is targeted outreach to groups likely to encounter psychosis, so schools and colleges. So I'll show a slide. The next slide is really what we did to target that group. First responders, hospitals, primary care, community partners to focus on what early psychosis care can look like and what to do next. And then our last prong is rapid access to care, which is really anchored by our referral line and our close partnerships with the LMHA, basically making sure that people get into care quickly. So at the STEP Learning Collaborative, we have a dedicated team member that leads outreach and education to all levels within the educational sector. The work engaging educational sectors, stakeholders in 2005 and 2025 highlighted trainings that were specific for this group, informational sessions, outreaching to nearly all of the colleges across the state, and attending campus events that reached, I think, nearly 2,000 students statewide. Our director of social work also conducted which you can see here in the top right corner, a series of informational sessions targeting school counselors and other school-based staff. That was in the latter part of 2025, and we had a representation from over 115 Connecticut school districts. We also have a liaison to first responders who's responsible for developing relationships with law enforcement agencies, fire department, EMS, mobile crisis. This role really ensures ongoing communication and training and resource sharing to support safe, compassionate, and effective response when first responders encounter individuals experiencing possible psychosis. We've curated a lot of materials for the STEP Learning Collaborative, including brochures and a one-page flyer that's really specific for helping support inpatient staff around the eligibility criteria for the STEP Learning Collaborative, which you can see here is it's a short list. So we wanted to make it really clear to folks that this is the number you call and this is exactly what we will do. All of these resources I'll mention are available on our website that anyone can download. I want to highlight an important example of stakeholder feedback that we worked quickly to implement within the STEP Learning Collaborative. We were told by an undergraduate student that undergraduates, which is much of a big group of the eligible participants for the STEP Learning Collaborative, will not walk around with a brochure. So we created these pocket-sized cards that have our referral number, our website, and QR codes, which we've also have, as you can see, integrated into a lot of our materials. They've been well received at college and university fairs, but we also see them being utilized in other settings, like a waiting room, for example, where somebody can quickly grab it and put it in their pocket. You can see that we have two cards here supporting communication in psychosis and are you concerned about yourself or a loved one? Those two are being distributed at trainings across the state that our liaison to first responders has been attending. So in collaboration with Red Rock and Students with Psychosis, we created these 16 videos featuring stories of individuals and or family members with lived experience of psychosis. They're all available on our YouTube page, and we also created these shorts, which are clips highlighting key aspects of these powerful stories. And we want to continue to highlight individuals and families with lived experience. So those are all available on our YouTube page. So this figure looks like a lot of lines, but I will explain the importance of it. So data and informatics are central to the STEP Learning Collaborative and what makes this a learning health system. So we're collecting longitudinal outcomes across many domains, which you can see on the left. So a lot of those are abbreviations, but I can quickly explain some of what they are. So we are collecting these and allowing us to which allows us to benchmark our performance against national and international early psychosis standards and use those data to guide continuous quality improvement. Sorry about that. So we're across different domains. So symptoms for individuals, their functioning, their treatment and health. We also want to understand satisfaction. Are they satisfied with their care they're getting, which we feel like is an important element for us in gathering information to drive the Learning Collaborative forward. We want to hear from people that are a part of the Learning Collaborative and getting treatment at agencies, including STEP, to see if they are satisfied with the care they are receiving. So the data, the display on the right is how we use this data to visualize some of what we're gathering. And it's just one example of how informatics can inform quality improvements in care. So we continue also to bolster our workforce development, which is a key streamline in the, if you remember the STEP Learning Collaborative video, one of those streamlines that was mentioned. So quickly just mentioning, we have a STEP Hub consultation, which is really for clinicians, administrators, and leaders of healthcare systems who want to consult about their continuing care of young people with recent onset psychosis. We also have 6-session early intervention services course available on our website. All our provider trainings are recorded and available for anyone to view on our STEP Learning Collaborative YouTube page. And we are also continuing to do outreach and educate families and interested community members. So we currently have a family and education series that Dr. Sykes is running, and those are also recorded. We're excited that we now have a family educational workshop in Spanish that is on our YouTube page, and we continue to do blogs and offer materials on our website. We provide education on the link between cannabis and psychosis that, as you can see, like one of the pocket-sized cards, we have an information sheet available for download, and we have a blog post about cannabis and schizophrenia, as well as a training available on our website that really talks about the link between the two. This very quickly highlights our progress to date. I won't go through all the numbers, but all of it is available on our annual report, which is in the QR code to the bottom left. But we've had 571 inquiries to our central referral line, and 74 individuals connected to care. That was in as of late 2025. So that is our mission, again, is really to deliver safe, timely, and effective pathways to and through care, make things easier and faster for people to get in the door, and make sure that once they're connected, the care they receive is timely, coordinated, and effective.